Good morning. It's good to see so few of you here today practicing safe physical distancing. We have today on the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations. I want to make another series of statements with respect to our COVID-19 action plan. It's been 8 weeks since the first case of COVID-19 was confirmed here in British Columbia, and it amazes me how much our lives have changed in that time. It's a stressful time, it's an uncertain time, but people have been resilient. Every day, health experts give us the latest information and advice to stop the virus. Frontline workers report to duty, caring for people and protecting them from harm. Businesses have been finding new ways to operate by adapting to the needs of their customers, as well as directives from the public health officer. And more people are taking up the charge every day to help their neighbors, to help their friends, to help their families, and to help their communities. That's inspiring, and that gives hope to those healthcare workers, those frontline workers that are putting themselves at risk every day to do what they can to make life better for those who have become ill. But we need to make sure that people can count on government to put forward the best possible advice we're receiving from experts, to make sure that British Columbians are safe, to make sure we can continue to get through this together. We've been calling on businesses and people to do what they can, and they have been doing everything they can to support healthcare workers. We have their backs, they have our backs. That's the way it should be. As you know, on Monday we announced a $5 billion package for people and businesses. Yesterday, we announced a package for renters and landlords, and earlier in the week, we put in place legislation to protect workers through employment standards changes so that they can be protected if they become sick. Today, we're taking the next steps in that response to protect supply chains, to stop people from reselling goods and medical supplies, to define which businesses are indeed essential services, and to make sure British Columbians are complying with public health officer orders. The steps we're taking today are unprecedented, but I find myself saying that almost every day. These are uncharted territories for all of us, but together we'll get through this. This is not a drill, it's a pandemic. We're facing tremendous challenges, and together we can get through them. But to do that, we all need to be pulling in the same direction. Local governments, businesses, Indigenous communities, and people from every part of BC. We need to follow the orders of Dr. Bonnie Henry and the public health officers. They're not suggestions or good advice, they're the law. We're counting on everyone to do their part, and BC's action plan will get us to where we need to be in the days and weeks ahead. I'm now going to turn it over to Minister Farnworth to talk about some of the changes we're making today so that people have a better understanding of what our BC COVID-19 action plan will do for them in the days ahead.
Thank you, Premier, and good day, everyone. I'd like to acknowledge that we're gathered on the territory of the Lekwungen peoples and the Songhees and Esquimalt First Nations. I'm Mike Farnworth, the Minister of Public Safety and Minister responsible for Emergency Management BC. COVID-19 is impacting all of us, touching our lives and our economy, and I know it's been extremely hard on people. Not only here in BC, but globally, we find ourselves coming to terms with a rapidly changing world. Adjusting to this new temporary reality isn't easy, but it's necessary. And I want to assure you that our government is working to alleviate the pressures that we're all facing. On Monday, you heard Premier Horgan and the Minister of Finance outline our plan to support people and protect workers. These efforts are in concert with the federal government's economic plan and will give immediate relief to the people of our province who are worried about paying bills and staying afloat. As House Leader, I also resumed the legislature on Monday to expedite our government's response to COVID-19 and some of the key actions to be taken in the coming weeks. I want British Columbians to know that these steps are being taken to support all of us who are doing our part to flatten the curve. These measures will allow us to do the right thing, to stay home when possible, look after our kids, and avoid community transition. All these measures have laid the groundwork for our government to take further extraordinary and unprecedented action, which I will be discussing today. We've now been in a provincial state of emergency for a week, but this health crisis has lasted much longer, and we're at a critical junction. We all need to ask ourselves, what are we doing to flatten the curve? Are we all playing our part? And most importantly, are we following the clear directions and orders of Dr. Henry? Provincial Health Officer Dr. Bonnie Henry and Minister of Health Adrian Dix have been tirelessly working to prevent the spread of COVID-19. And they have given us, all of us, important direction on how everyone has a role to play. While many in British Columbia are playing their part, we have all seen examples of some who continue to defy orders and instruction. Whether that is hoarding important medical supplies and goods or coming together in large groups. It has become clear that additional extraordinary measures are necessary to secure critical supply chains and safeguard the most vulnerable. I want to be clear, as the Premier just said a moment ago, Dr. Henry's orders are not suggestions or good advice, they are the law. And as Minister of Public Safety, I will exercise my powers under the Emergency Program Act to ensure that those laws are enforced. That is why, today, based on the recommendation of BC's health and emergency management officials, I am taking the unprecedented step to issue a series of orders for the duration of this provincial state of emergency to support our Provincial Health Officer and Minister of Health in our swift and powerful response to the COVID-19 pandemic. It's crucial that response and recovery is coordinated and that we move forward in lockstep with federal and local governments under a single action plan. I know many British Columbians are worried about our flow of essential goods and our ability to ensure shelves are stocked. Therefore, effective immediately, we have established a new provincial supply chain coordination unit to work in partnership with industry to coordinate goods and services distribution. And any bylaws that restrict the delivery of goods at any time of day are repealed. The province, through Emergency Management BC, will take a more active role in coordinating essential goods and services movement by land, air, marine, and rail. And at EMBC's request, retailers and suppliers must report on inventory of critical supplies, including health supplies for frontline workers. To protect British Columbians and give everyone the peace of mind that they will be able to buy groceries and other essential supplies, we are prohibiting the resale of food, medical supplies, personal protective equipment, cleaning, and other essential supplies, and working with retailers on measures to restrict quantities of certain essential products at the point of sale. These measures will help end hoarding at our grocery stores and the shameful black market for medical supplies, making sure our essential service workers, including health workers, have every resource available that they need to continue with their incredible efforts in caring for all of us. We are at a critical stage in our response to COVID-19. The message from health officials is clear and simple. How we act today will determine our future. Most people are doing the right thing, staying home, staying physically distant, and adjusting to life at the direction of our provincial health officer. As I said again, and I'll remind everyone, Dr. Henry's orders aren't suggestions, they are the law. To that end, we will be enabling municipal bylaw officers to be redeployed to help ensure compliance with the provincial health officer's recommendations and orders which could carry fines or even jail time. The PHO's recommendations and orders include physical distancing, making sure that businesses ordered to close are staying closed, and that gatherings of more than 50 people don't take place. I want to commend the passion and dedication of our frontline workers working to fight COVID-19 and keep people safe. And I also acknowledge the steps many communities have already taken to respond to this health crisis. Many local governments have declared local states of emergency in an effort to combat this pandemic on the front lines. But in these unprecedented times, it's more important than ever to coordinate emergency response to better serve and protect British Columbians. Effective immediately, municipal states of emergency related to COVID-19 are suspended. This will ensure a coordinated approach is taken under the provincially declared state of emergency. Local governments are key partners. To that end, local governments are being asked to identify and make available any publicly owned facility that may be used for pandemic response, including facilities for self-isolation, medical care, and testing. That they must respond to any requests for information from the province to identify resources and critical supply and service needs. This is not an exhaustive list, and more information on these measures will be available in the coming days and weeks ahead. I'd like to take a minute to acknowledge the many people adapting at work and at home to the new environment under COVID-19. All those people working in essential services to keep society running, thank you. If you're adapting your business and finding ways to work from home, it's important that you continue to do so. In fact, it's crucial. Every day you log in from home, you're doing your part to keep your community healthy and safe. These are unprecedented measures for unprecedented times, and these are actions I would not be taking unless absolutely necessary. Our frontline workers are supporting all of us through this health emergency. The rest of us need to do our part by supporting them. As the Premier said, they've had our back. It's time that we have theirs. And we can and we will by following the Provincial Health Office's orders, staying home and keeping our essential goods and services flowing. Now is the time for all of us to be kind, to be calm, and to be safe. But it's also a time to be selfless, to know the decisions you make today could drastically impact the lives of your family, friends, and neighbors. So I want to close by saying, follow the advice of the public health officer. Be vigilant about your hand hygiene. Maintain physical distancing. Do not leave home if you're sick. And remember, public safety orders in place from the provincial health officer and the province must be followed. Failure to do so will have real consequences for all of us. Thank you.